kind of pace when I'm nervous, so if I pace too far away, let me know, all right? So at that time, we talked about interoperability and translation capabilities with an untethered personal health record. At that time, I mentioned the initial process of our API development for integration of the untethered personal health record using FHIR data field. So that's where I'm presenting today. For disclosures, my wife and I are both physicians. My wife's a board-certified pediatrician. She's at home on sabbatical taking care of our 4 children right now. I am a board-certified neurosurgeon with a full-time practice. So by nature, I am not trained in the tech aspect of this. So if you have any questions that I am unable to answer, I will direct you to our development team to make sure we get those questions answered. I do practice at Penn State Health in Reading, Pennsylvania, but I'm not here representing them in any way, shape, or form today. My last disclosure is the fact that I'm pretty safe and confident that I'm the first person to present the cutest picture of the day with my wife and children, and I would not like it to influence your voting at all as to who's going to win this session. So the goals of today's presentation. No, I'm not sure exactly. I heard somebody talk about seizures, and yeah, that I can take care of, okay? All right. I'm not sure exactly what's going on. Huh? Okay. Well, as they're looking into that, I'll try to keep talking here a little bit. So the goals of today's presentation is to understand the need of a untethered personal health record and introduce everybody to MINAH. And then after that, we'll talk about data field mapping of the individual data fields within MINAH to the database with FHIR. Okay. All right. So as I can attest, and as well as our diverse team of medical physicians associated with MINAH, that there is a basic set of information that is required to perform high-quality care to any patient across the globe. This quote from the WHO states that high-quality and up-to-date health data are essential for identifying health needs, informing decision makers, and eliciting actions to improve health outcomes. So it's easy to know that there is a standard set of information that is required and is just the foundation to provide health care. And, you know, like I said, this is required across the globe. And, you know, I know we have some individuals here from Australia, and I'd like to say that, you know, with our standardization tool that we have created now, we've also filed IP applications, and it actually had a first pass allowance in Australia to try to get everybody communicating on the same level when it comes to the personal health record. So what is the personal health record? All right. The personal health record is that standard set of information in your medical history that is reported by the patient. This is a process that is happening across the globe every time you go to a doctor, even at pharmacies or urgent cares or a podiatrist or chiropractor. Across the board, we're already doing this. MINAH is just trying to improve upon that process, make a standardization and a better way to communicate that information. So with that introduction, I want to show a brief video based upon the consumer perspective of what MINAH is, and this is a video we put together a couple years ago. And the video didn't play. If I can switch over to the web, I'll pick it up off the web here. Now we don't have sound. Okay. This is good. They say that your ability to adjust in stressful situations is a good test of character. Let's see what we got here.
By novel acquisition. Welcome to MINAHealth, the revolutionary way of collecting, storing, and transferring your health information. MINAHealth stands for Medical Information by Novel Acquisition. It is dedicated to evolving the way that you, the user, communicate with your healthcare provider. MINAHealth was developed by a team of physicians, as well as individuals just like you, to ensure that MINAHealth would benefit everyone. People have gotten frustrated and tired of filling out redundant forms each and every time they visit their healthcare providers. Whether it be a primary doctor or a specialist, a chiropractor or a dentist, each visit requires a form with the same basic information. Despite the redundancy of these forms, physicians need them so they have the most accurate information to provide the best and safest care. Now with MINAHealth, everybody wins. MINAHealth is a smartphone application that allows you to store your health information securely. Now when you visit your doctor or any other participating healthcare provider, you can safely and easily communicate your medical history without filling out multiple paper forms. And since most families have 2.5 kids, a dog, 2 cats, and an aging parent to look after, you can store the information of your children, parents, and any other dependent. The goal of MINAHealth is that you will simply need to enter your information once, while making only minor changes over time, limiting the need to remember details each visit. Your health history is then converted into your personal health blueprint or QR code for easy and paperless transfer when scanned by your provider. Simply download the application, follow the prompts for the required data fields, and show the QR code to your healthcare provider. You can also rest assured that no one can access your information without your specific passwords. We here at MINAHealth believe that everyone can benefit from this application, and that's why it has been developed across Windows, Apple, and Android platforms. A temp version will also be available for those who do not have a smartphone. So why should you download MINAHealth? Because not only will MINAHealth reduce the number of forms you need to complete, but even more importantly, it will improve the accuracy and comprehensiveness of your past medical history. And more accurate information leads to better care. MINAHealth is a more efficient, accurate, comprehensive, encrypted, safe, modern, user-friendly, reliable, and cost-effective way to store and transfer your health history. Oh, and the best part? It's completely free, with no in-app ads or purchases necessary. So we encourage you to download the app today and join the MINAHealth movement.
Really? Now you're going to play? So, that standard set of information that I was talking about is basically preached to any healthcare provider early in their training. That, of course, is the past medical history, past surgical history, allergies, medication, family history, social history, and review systems. In MINAHealth, we have broadened that just briefly to include immunization and health maintenance. Now, that information that is incorporated into the standardization questionnaire within MINAHealth is not encoded into the QR code letter for letter. It is condensed down to a third-party identifier and then encoded into the QR code for transmission to your provider. But understand that that QR code is actually information. It does not direct to a third party, a repository of that information, and now that information truly is at the fingertips of the patient. So next I want to just pick 2 data fields within the MINAHealth smartphone application to describe to you and show where it maps into FHIR database. And I picked these 2 data fields specifically because one of them maps directly into FHIR and one of them doesn't. And I want to show you how we have overcome that problem. So on the screen here you see examples of about 15 of the standard responses for the past medical history. These responses have then been linked to the SNOMED code, and that's how we're going to integrate it into FHIR. Also on this screen, though, has the Spanish version of each of those standard responses, and that's part of our pending IP as well, in that this smartphone application can translate between languages. The second data field here is considered the social history. The social history is a standard questionnaire that you will receive at all your providers, but as far as we can tell, and for our own internal research, this has not been standardized. This includes information about smoking history and education and occupation and things like that. I would love to work with FHIR so that we could create a more standardized social history to incorporate in the next version of FHIR. Okay, all right. But before I actually show where the mapping of this information will go into FHIR, I want to try to show you a brief video about the desktop software in use if it works.
This is a brief video that demonstrates how easily and efficiently MINAHealth works. It's very straightforward with minimum steps, making the program easy for any office staff to use. The first step is to make sure the scanning device is either installed, such as a built-in camera on your computer, or connected, such as a handheld scanning device. Double-click on the MINAHealth desktop icon to open the program, and then either click Scan a QR code on the left toolbar or in the bottom center of the screen. Select your scanning method of choice, the computer's camera or the scanner. Place the QR code approximately 6 inches from the scanning device, approximately the distance from your wrist to your elbow, and scan. You will then be prompted to select which sections you wish to transfer. Once your selections are made, save the information as a condensed PDF to your desktop. Now it's ready to be integrated into your office workflow.
So this is condensed and standard information that has now been provided to the providers. Now, not all providers have EMRs, and in the current state, MINAHealth can integrate into normal workflows in a number of fashions. But of course, the gold standard would be auto-population into the EMR, and that is where our integration in today's presentation demonstrates. So, right now, MINAHealth is working with 2 open source EMR systems, Hospital Run and Open EMR, for auto-population and integration of the information from the MINAHealth smartphone application into their EMR system. We were lucky enough to know the lead technician on Hospital Run, and so they have adopted FHIR for their data field directory. Open EMR is already well known within the FHIR community. So most of the fields within the smartphone application can be mapped directly into FHIR into different regions. I like to use the example of past medical history, which I alluded to before, because we have actually linked our third-party identifier to the SNOMED code, and then that can be integrated into the EMR. But not all fields do directly link into the FHIR database. And again, this goes back to the social history, which I described earlier. Because there's not a direct link, we have taken the questionnaire and the standard responses, and we have deposited into the questionnaire section within FHIR. So the algorithm of how things work right now, and the brief demonstration is on the MINAHealth software desktop application, you get a screen like this, and the staff needs to configure the FHIR server endpoint for where this information is to be uploaded to. After that, the system is very similar to what was shown in the video, the one that did work, in that you scan the QR code, that information is then provided to the provider, and instead of converting it into a PDF like it showed in the video, you would actually circle or select this upload to FHIR server icon. At that time, there is a query within the FHIR server to see if there is a profile that matches the information that we are uploading into the server. If there is not an identical profile, then that information is used to create a new profile. In the situation that there is a profile that is there, a pop-up menu or pop-up screen comes up for the provider to either confirm that that is the same patient or actually create another new profile. After that, the process is pretty standard, and it's automatic, where we showed where the information maps previously in the presentation, so that information is dumped into the appropriate regions within the FHIR database. There is a reconciliation process so that there's not duplicate responses for things like in the past medical history, and then the questionnaire for the social history, of course, is auto-populated. This is an example of the data that was shown in the previous few slides being uploaded into FHIR. So now we have proof of concept of where we have an untethered personal health record that can select and store that foundation of information that is needed to provide high quality care across the globe. And that information can be converted into a QR code. That QR code can then be scanned, and that information can go into directly into an EMR system with the FHIR database. We consider this the MINA win-win for both patients and providers. Now that we have this proof of concept done, our hope is that we'll have more interest in terms of collaboration. This is my contact information. Please use it to contact anybody from WonderHealth and MINAHealth. Please also remember that I'm a practicing neurosurgeon, so during the daytime I'm normally busy, but I will get back to you, and we're looking for collaborations. So, thank you.